Hello, everyone. Well, if you're watching this, you've been recommended some at-home care for your neuropathy. We want to do two things at home that your provider will let you know as far as how often that you need to use them. The first thing to do is for blood supply. We're going to talk about that first. And the next thing after this video, if you've also been recommended, the rebuilder is used for nerve supply. So first of all, to promote blood supply, we are a big fan of the red light and near infrared light boots. We use NeuroCare. They back their product really, really well. And with this, your provider will unpackage your goods for you. And there is a port controller. We'll show you how to plug that in, and then also how to place on your boots. Now, please note that these boots do not go through any clothing, so make sure to take off your pants, your socks, your shoes, because they will not penetrate those. And I like putting the logo up the top so it's not upside down like this. You'll find out why in a second. So placing your boots in, they're both the same size, but just place your heel right in the crevice of this, and then place on your boots just with the Velcro straps. They don't have to be tight, just nice and snug is totally fine. But placing like this. And then when you do the bottom Velcro, please just don't flop it on the carpet, especially if you have any pets or anything like that, because they will not replace the product because the Velcro has gone bad. So partially lift up your foot just slightly as you put your Velcro on this way for the top and bottom. And you can see how it's a little bit loose, totally fine as the way it fits. Your other foot would be just the same. We'll do it quick here. Putting this one on so you can see how easy it is to apply the boots. Now these same, I'm calling them boots, but basically they're pads, because these same pads can be used for your hands as well, and we'll show that and demonstrate that for you in just a second. But again, lifting it up, and you're ready to go. And the reason why we put the logo at the top, because the plug-in for the boots would be up here as well. If not, you're bending way on over and you're trying to plug them in at your toes. So you'll have your port controller that you'll be plugging into the wall, and that is there here. And to turn it on, there's a switch on the bottom. And what you'll see a little bit of a countdown that'll take place. And once it counts down, you'll see 21A. 21 means the minutes, and the A behind it means the setting that it is. So you're using these for neuropathy. So think N for Nancy, N as in Nancy for neuropathy. So placing your finger on the top button and pushing the mode setting, bring it to the N2 setting. N1 is 21 minutes, and N2 is 32 minutes. So once you're on N32, you can plug in the port controllers. Note that they're all the same size. You can't plug them in one end wrong. And then you would place these into your boots as well, plugging the top one into this boot and plugging the top into the other boot. You're ready to go. Now, after you're on the N2 setting, the button right below the top one is on. And once you place that, you'll see that the boots are currently active and going. Now, you can't see near infrared light, but that's what's doing the most good for you. You can see red light. And they put red lights on the boot just to make sure that you know that they're on. You're going to see this toggling back and forth back here. It says 73, that sort of thing. Don't worry about that. That's just the algorithm that they use for the machine. And you're going to see this 32 going down to 31, 30, and so forth, down to 0. Once it's off, you can just turn the unit off. So pretty simple. There's a plus and a minus button down here as well. Don't worry about those. That's just to change frequencies and that sort of thing. But everything's been pre-programmed for you. So basically, turn the unit on. Go to N2, neuropathy 2, N2, plug your boots on, and push start. So if you want to get fancy, somebody calls you, you have to get the phone or get the front door, you can push the second button here, which is a play pause button. And when you place this, it pauses the red lights. After you've answered the door and come on back, you can just push start again, and then your time will resume. So that way you don't have to keep track of where you're at. So that is the red light and near infrared light boots. And your doctor will let you know how to use them and how often. I like to use these boots first because it creates vasodilation. And whenever we have dilation of our blood vessels, it brings blood flow to the area. So I like to start off with the boots first if you're using this and your rebuilder. So for application for hand use, it's really simple. You have 2 pads, 1 for each hand, of course. And once again, you can leave on your rings and things like that. However, make sure to take off any long sleeves, anything like that, so making sure that you're getting full use of them. So you basically just place your hands in the center of the pad and place this one on top like this. Then you would place your other and get the straps out of the way of the lights, out of the way of lights, of course. Just move the straps out of the way, and then place your other hand right in the middle here and place that one just like that, and you're ready to go. Same thing, just going to N2 on the controller and start. Pretty simple. So after you're on the N2 setting and both hands are in here and ready to go, reach one hand out, the second button from the top, place it, the lights will come on, put your hands back in, and then you got your 32 minutes applying it to your hands. When you're storing your pads, please put the straps right towards the middle. And then after you've done so, just kind of fold them to the middle. That way, the straps are in nice and tight and they're not left loose collecting hair or dust or anything else of the sort. So fold the pads to the middle and then fold them on themselves. So the other rebuilder that I'll show you has a carrying case that comes with it. However, for your pads, we have this carrying case here where everything fits in nice and easy. So just an FYI, not only symptoms of neuropathy, you can use the NeuroCare boots. However, you can use them for other aches and pains and also cosmetology uses. For aches and pains, right when you turn on a unit, you're going to see the setting A that comes on here. That is for aches and pains. So if you have an ache within your back, feel free to place the red light pads up on your back and leave it on the A setting and hit start. And if you wanted to use it for cosmetic uses and that sort of thing, push the mode button until you go to C, and C is for cosmetic. If you do apply it to your face, please use appropriate goggles. But for your hands, your back, your neck, things like that too, the C application and start there as well. You'll be provided a sheet that is giving you instructions upon everything that we just went through today, and also a sheet that'll show the A, the C, and the N setting that you're going to be using for your neuropathy. Wanted to let you know that if you wanted to use your red light pads on the go in the car, we do have the little converters here at the office most oftentimes, or you can buy them online, or you can just plug your red light pads into the cigarette outlet of your car that you used to use them for their 12 volt. However, please note, please only use these products as a passenger. Never recommended ever to use these products while you're driving, of course. After we've had all of our NeuroCare boots in our to-go bag, let's go on to the rebuilder that you've been recommended. The rebuilder is to help your nerve supply, and it creates a nerve stimulation. The rebuilder runs off of a 9-volt battery, which you'll see in the back of the unit. There is an extra 9-volt battery that is in the carrying case that comes with the rebuilder, and the mesh side. And there is, for this one, the cable that comes with it, there's a little gray dot that is right on the front of this cable. The gray dot lets you know that it goes towards the front of the unit. It's odd shaped, so you would not be able to plug it in wrong, but it's just a reminder as far as how to plug it. And when you plug this one in, you're ready to go. Basically, after you plug it in, you're gonna turn it on and let it do its effectiveness. There's 3 ways to do the rebuilder. We're going to show you the best way first, the second best, and then the third best last. So the best way to do the rebuilder is to use the water, any water basins. Now these are just plain shoe boxes that you can buy at your local convenience store or grocery store. And what you do is you just place fill the water about up to here, about 3/4, just so that when you place your feet in, the water don't overfill. So we're gonna have a wonderful model place to feet. I made the water even warm for you. How about that? So after the feet has been in the water, then you just take your rebuilder leads. I pulled them apart just a little bit, so you can just place one lead into one basin of water. Then you can just place the other lead into the other basin of water. It does not matter whether the lead is maybe touching your foot or not touching your foot or anything like that. It won't have any degree to impact the effectiveness of it. We have some people who get cute and maybe put like a little clothespin holding it towards the side or whatever. But as the leads are in the water, then with what you want to do, you just want to turn on the unit just slightly. You're going to turn it in a clockwise manner, and you're going to see a green flashing light, and that green flashing light will come on. Then what you want to do is you just want to turn up the intensity to match your comfortableness level.
Oh,
Can you feel that? Yeah. So if your feet are numb and you're not able to feel it, go ahead and turn that all the way up. If you wanted to feel it buzz and tingle just a little bit, you can add a pinch of Epsom salt to both sides. And when you add a pinch of Epsom salt, it does not help with the effectiveness of it. But sometimes people are like, I feel like I'm just getting more benefit out of it when I feel it. So feel free to add a pinch of Epsom salt with it as well. Turn it up towards your comfort level, whatever that is, and stop right there. What is a comfortable level? You should actually be able to fall asleep with these on, having it comfortable. Do not think, please, that more is better. Like if it's effective, I'm going to really turn it up as high as I possibly can so I get the most effectiveness. Please don't do that. There's no need. If it's on, it's on. So comfortableness level, leave it right there. When the timer's done, there's no clock on this one which shows the minutes, but this one goes from about 28 to 32 minutes. And after that time frame, the unit will shut off. And when it shuts off, turn the dial and make it click and shut off. You can pull your leads out. You can dry your leads off if you would for me, please, just with any paper towel or regular towel. And then take your feet out and dry them off as well. And then your treatment there is done. If you're doing your hands and your feet treatment, while you're using your rebuilder for your feet, you can be using the red light pads for your hands. And once that's completed, you can use the rebuilder for your hands and then the red light boots for your feet. So the water basins are the best way to use your rebuilder. Please do that as much as you possibly can. However, if you're traveling like in a car or going to a friend's home or leaving on vacation for a while, and you don't want to be messing with a water basin and water in your vehicle or traveling, trying to fill up tubs, you can use your socks. They made that real convenient for you. It's copper lined socks that you can use. The tag is on the outside. I'm used to all my tags mainly being on the inside of my clothing. Maybe they did it for marketing purposes, but when you're ready to use your socks, please just turn both socks inside out. Then you'll be supplied with some electrical spray. We keep this on hand at all times, and there is an 800 number. You can buy it here, or you can even buy it online if you'd like. The electrolyte spray, you'd pull off the little seal on top, then you can place in the spray bottle. And it helps increase the conductiveness of the copper line socks. So with what you do, you just spray each side of the sock 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Flip the sock over. Now you're ready to go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, as our foot model places them on, I just want to tell you just a little bit about the electrolyte spray. You can use water to get them wet. However, if you ever had a washcloth that you got wet and put on your sink, and the next morning you went there to go look at it, that washcloth is hard and a little bit crusty and in the shape of the sink. Well, if you got it wet with the electrolyte spray, that washcloth, you put on your sink, the next morning you went down there to go grab it, the washcloth would be just as soft and as pliable as the day that you before you got it wet. And that's what electrolyte spray is. There's no heavy metals in it or anything, so it really protects the life of the sock. That's why we recommend the electrolyte spray versus any water. Just to protect your product. Once the socks are on, you can take the leads and you can just plug them into each side. Grab a hold of the circular part and just plug them into each side like this. And after they're plugged in, you would just take the unit once again, turn it on, so you see the green light flashing, and then once it's flashing, you can just turn it up to your comfort level. And after it's at the comfort level, then you would just leave it there until the timer is gone. And once the timer goes off, you can just turn it off. And once you pull these plugs out, please just don't grab the garment and pull on the cord, but please secure the knob and then pull the lead from it. If you wanted to wash your socks, you may. there is a little tab. Put your fingernail underneath this tab and pull on off, and you'll feel the tab of the sock come off. And this little tab, please take this off before washing because if water gets behind there, it'll rust and it may lose its effectiveness after time. And, after you wash your socks, you can just clip them back on. Why the water is the best is because it gets in between every toe. Why the socks are good, second best, is it does do your entire foot and your ankle, however, it does not go in between each one of your toes. Once you've taken your socks off after a treatment, just give them just a half fold if you would, and there's a mesh side towards your bag. The mesh side towards your bag is where your socks would go. Please, after you've used your socks, don't shut your unit and zip it all the way up and make it airtight. Give your socks a chance to just air out. That's why this is made mesh here, so they have just a chance to breathe, and do so. So that's the second best way of performing your rebuilder. The third best way of performing your rebuilder is by using sticky pads. So sticky pads, this is simple. You can just use one sticky pad and apply it to the bottom just of the arch of one foot. Then you take the other sticky pad and just apply it to the bottom of the arch of the other foot. Now, instead of placing your leads in the water or placing your leads on the socks, you would just place these leads just plugging into your sticky pads. Same thing. Once those are on, turn it on to see the green light. Turn it up to your level of comfortableness, and then wait for the timer to go off. Again, the water's better because it goes in between every toes. Socks do all the area of the foot, but the pads just work the area that's around the pads, so that's why it's third best. But however, still effective. Once your pads have been taken off, you can just reapply them to the plastic that they came upon, and you can unplug them, and you can definitely use them for additional use. I like to keep everything within the mesh bag. I take out the center part of this box here. That way, when we're using your builder, I like to just leave this plugged in. I just give it a few turns. Tuck the cord right behind the rebuilder, and just store it right there for easy use. Now on this one, if you're traveling with it and your socks have been dried, you can just zip it up and everything stays into one compartment. If you've been told to use your gloves for the rebuilder, the same thing applies if you'd watch the demonstration for the socks. I kind of like to put my hand in the glove, and then just at that time, that's an easy way of turning the blood inside out. That way, just the same. You don't have to make sure that every single finger of the glove gets turned inside out, but just the inside of the palms for sure. So once the gloves have been turned inside out, the same thing applies as you place the glove down. Each side 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And the same thing on the other side. Perfect. And as our model turns them right side out and place the gloves on, I wanted to tell you that if there's any time where you feel like your gloves or your socks aren't as effective as when you had first put them on, while your gloves are on or while your socks are on, and as the rebuilder's green light's on and working, you can take the solution and spray your gloves while your treatment is going. So with this one too, just the same. With your unit plugged into both your gloves, the right side and to the left side. And then you can use your gloves on this one, reach on over and then turn the unit on and up to your level of comfortableness. If it starts out to be where you feel it tingle and then it's kind of losing its effectiveness, you can take the spray, and while the gloves are on or the socks are on, you can spray the outside of the glove while they're on and the other side, and you can feel that the intensity rise just a little bit. If there is like a little fold in your glove up to one spot or a little wrinkle in your glove, you may feel a little bit more of the effectiveness at that point. No problem. You can just kind of straighten out your glove and move it around. You will feel some more effectiveness of your socks as well. Like if you're putting your feet with pressure on the ground versus no pressure on the ground, you may always think that your socks and your gloves are always kind of on the wrong place of the part. But I'm here to tell you, if they're on and if the unit's on, it's working. Don't spend too much time to get a perfect uniform tingling sensation throughout the whole hand or the foot, because it's not as easy to do that using the gloves as it is with the water. Please note that before you use your socks that have been recommended to you or your gloves that have been recommended to you, it is a good idea to just wipe down your feet or your hands wherever you're applying them. If your feet are dry and have some dry skin, it really takes off of some of the dry skin off your feet, wiping them down prior. And if your feet are oily and maybe a little bit sweaty, wiping them down also takes some of the oil out. It preserves the life of your gloves and your socks. However, if they do get dirty, feel free to hand wash them. Once again, put your thumbnail underneath there and pull a little tab off. And once the tab's off, you can just use a light little dish soap, laundry soap, and then you can wash them that way. Or just take a little white, like ivory soap, and just you can hand wash them also, just in the sink. Hang them up to dry. Once they're dry, you put their tabs back on, and they're ready for another use. Just a reminder that when you're using the rebuilder upon your hands, the best way to do it as well is to use the water tubs that was demonstrated with your feet. A lot of patients find it very useful that on the side of their chair, they put an end table on both sides where they're placing their hands in the tubs. Same thing applies, putting the lead in the water and turning it up with your hands. It's a little bit tricky if you want to turn it up or down with your hands inside the water. Possibly place a towel next to the end table so you can just draw off just your fingertips before you turn up or down the knob with it. And the third best way to use your rebuilder for your hands also is the same way that we applied the sticky pads to your arch of your feet. You can take the sticky pad and just place them right upon your palms on the inside. Then you can place your leads onto each side and then turn up your rebuilder to your level of comfortableness. In using the rebuilder upon your feet or your hands, if at first you don't feel any tingling, buzzing, any sort of sensation with it, that's okay. Unfortunately, it does mean that your feet are a little bit more numb, in which you're not able to feel it at that time. But a lot of our patients, after a time of use and after the treatment that they've gone through with our office, are able to start feeling their hands more and more as the time goes by with using these products. For the rebuilder, just as with the lighted pads, there is an instruction book that goes through everything that we've just gone through here today if you have any additional questions. And please note that we are here and available if you have any questions at the office, 712-276-4325, or if you happen to be popping by, make sure to ask in person. Well, I hope you found this demonstration helpful. Please note that the best thing you could possibly do is be consistent with applying these. If you had a choice, do the red light pads first and then the rebuilder afterwards. However, it does not matter which order that you do them on as far as their effectiveness. But please keep up with the frequency that has been recommended to you. About a half an hour with the red lights and a half an hour with the rebuilder. You're at least looking at about an hour a day, but I'm here to tell you it's worth it. Here's to your health.